What I really liked was the opportunity to improve safety for our patients and to also really improve not only the safety and the quality, but also an opportunity to reduce costs.
The initial investment we made in e-prescribing was around $1.6 million, and that was for the primary care and specialty care rollout. The ongoing cost for e-prescribing is about $600,000 per year. But through the first 2 years of implementation, 2005, 2006, we estimated we saved about $1 million, and we expect to be saving about $1.6 million in each year thereafter.
In fact, recent data indicates the results of e-prescribing at Henry Ford Medical Group speak for themselves. Over 150,000 prescriptions were changed or canceled due to drug-to-drug interaction warnings. More than 11,000 prescriptions were changed or canceled due to drug allergy warnings. More than 70,000 prescriptions were changed or canceled due to formulary warnings. And Henry Ford has improved its generic use rate from about 57% to almost 68%, a 19% improvement.
The savings are really focused on improved generic use rate, reduced adverse drug events, and administrative savings. So those are the key components from a financial perspective. What we really couldn't put a price tag on was the number of lives we've saved.
Anyone else who's been sick at home.
Lives that are now better protected thanks to e-prescribing. Today, there are more than 750,000 active patients in Henry Ford's e-prescribing system. And the impact of the rollout is dramatic, with more than 800 of the group's physicians connected.
The initial reception to e-prescribing within our practices was so powerful and strong that we had doctors at various clinics knocking the door down to get e-prescribing. And in fact, it wasn't hard to spread at all. People, doctors loved it, staff loved it, nurses loved it, and patients loved it.
The positive experience of both practices is reflected in a recent study of 123 Henry Ford physicians that assessed the benefits of e-prescribing on safety, efficiency, and the quality of patient care. 85% agree that e-prescribing has improved the practice of medicine at their clinic. 77% agree that e-prescribing improves safety of care. 75% agree that e-prescribing improves quality of care. 57% agree that e-prescribing reduces the total time spent by support staff on managing medications, and 70% agree that e-prescribing improves patient satisfaction.
And the study findings confirmed what we thought, and that is that the vast majority of physicians believe that e-prescribing has helped their practice.
My advice to the other IT experts who are considering an e-prescription initiative would be to make sure that providers get good content on the first day. If the content is not there, we will have difficulty with the adaptability. Once you have a design which can deliver the content, then the next thing to focus would be to keep the technology simple, because simple technology will get them to their end objective in a cost-effective and timely manner.
Adapting the new technology to current clinic practices and providing on-site training to doctors and staff before and during implementation also eased the transition to e-prescribing.
The support that we had for rolling out e-prescribing was phenomenal. The support that we had was actually a key success factor in the rollout. It was seamless, it was very, very hands-on, supportive for the physicians.
As the rollout extends its reach to more and more practices, Michigan is emerging as a powerful national model, raising awareness of e-prescribing as a more secure, accurate, and informed method for prescribing patient medication.
I would recommend implementing e-prescribing initiatives to other purchasers because we have been able to see the value that these initiatives can bring to the community and to the corporation. But it is very important for purchasers to have good partners in the community to provide feet on the ground and help physicians implement this technology quickly so that they can also see the value in their practice.
For me, to be able to implement a project that could actually make a significant difference in this community, it's one of those once-in-a-lifetime opportunities.